Hello everyone, welcome to sqadia.com. I am your educator Dr. Lara Munir, covering the hematology part of the internal medicine course. In our previous few lectures, we started talking about the myeloproliferative disorders. We started talking about what does the term myeloproliferative mean, how do we define those disorders, what are some characteristics that are common to all the myeloproliferative disorders, including the various types of mutations that cause the etiology of these diseases. A lot of diseases come under the umbrella of this term myeloproliferative disorders, but the major ones are the polycythemia vera, essential thrombocytosis, primary myelofibrosis, and the CML or the chronic myeloid leukemia. We talked about polycythemia vera and essential thrombocytosis in the other lectures. Our topic of discussion today is the primary myelofibrosis. Now, primary myelofibrosis is by far the least common of the myeloproliferative disorders, but it also has a higher mortality rate because it has slightly different pathology, it has slightly different etiology from the other myeloproliferative disorders. Let's talk about the basics of the primary myelofibrosis. As the term primary myelofibrosis, if we break it down, we mean that it is a primary disorder. It is not a reactionary response to any other disorder. And myelofibrosis means that it affects the myeloid lineage, which includes generally the granulocytes or the white blood cells, and erythrocytes and the platelets. And fibrosis means that there's a fibrotic process going on. So basically, it is a primary process which involves the fibrosis of the bone marrow, specifically the myeloid lineage. And as we have seen in the other myeloproliferative disorders, the mutations are almost the same, which we are going to talk about in the etiology part. And there are certain common characteristics common to all the myeloproliferative disorders, like all of these disorders can interchange. One disorder can transform into another. All of these disorders have the potential to transform into a malignancy like the acute leukemia. Apart from it, the hallmark of the primary myelofibrosis is, number one, there is bone marrow fibrosis, as it is evident by the term. There is some pathological process going on that causes the increased production of fibrinogen or collagen in the bone marrow. We're going to talk about the pathogenesis in the coming part, but bone marrow fibrosis is the hallmark of primary myelofibrosis. Along with that, when the bone marrow is fibrosed and it is not able to perform its job of producing the blood cells, then the hematopoiesis generally shifts outside of the bone marrow, which is basically defined by the term extramedullary hematopoiesis. So extramedullary hematopoiesis, the major organs being affected here are the spleen, the liver, and to some extent the pulmonary system or the lungs. But spleen is the major player because it is the one which is most commonly affected when the bone marrow is not doing its job, and it is the most common organ being affected in the extramedullary hematopoiesis. So splenomegaly is also one classical presentation of primary myelofibrosis. Basically, if you want to make a diagnosis of myelofibrosis, you have to have splenomegaly, and along with that, documented marrow fibrosis on the bone marrow tab. So these are the two major hallmarks which define this disease.